for more on this, Dr. Monica Gandhi. She's a professor of medicine at the University of California in San Francisco. Thank you for joining us, Doctor. You heard what the White House had to say. Are people listening to this?
Well, the White House is absolutely right that we need ongoing funding. And I think the way to think about COVID-19 is we're never going to eradicate it. In fact, any elimination strategy has been unsuccessful because it's in animals. There's multiple reasons. What we have to do is keep our hospitalizations and deaths low. And we are in a surge of cases. Our deaths are actually lower than they've ever been since March of 2020, but all that takes ongoing work. It's always work. Who to vaccinate next? Who needs a boost? Who needs treatment? And so they're absolutely right that we need ongoing $10 billion a year, what they're asking, funding to keep things in control.
There are people that I know that got tested positive for COVID with 0 symptoms, and here they are walking around among us, having dinner with us, maybe even working alongside of all of us. There's no way you can find all these folks. What's the solution to all this?
In fact, I do believe Shanghai's approach really showed that. You cannot test everyone and keep everyone away from all human beings. We have to think of this virus differently. We have thought, or some countries have thought, you can eliminate it. You just can't. It's not only smallpox has been eradicated worldwide, and it had very particular characteristics, including no animal reservoirs. This has 29 animal reservoirs. The way to deal with this is know that it's always with us, which I'm sorry about, and keep boosting, keep vaccinating, and keep treatments ready to prevent severe disease. But preventing cases, preventing mild infections, preventing asymptomatic infection, we've already seen over 2.5 years we can't do that.
And some experts are warning that this fall there could be another outbreak of new variants. How worried are you about that?
So the one thing that's interesting about Omicron is it was a variant that it's getting little offshoots, but there's not a variant that's totally different from it. And some evolutionary biologists are saying that enough of the population in the world has seen this virus or been vaccinated that we have enough immunity that we're going to get little offshoots for this subvariant, but we're not going to get a whole new bad variant. I'm hopeful about that. I actually think that makes evolutionary sense, but the WHO is prepared. They said if another worse variant comes, we're all going to need a booster. Not 80-year-olds, not 60-year-olds, not 70-year-olds, everyone. But this is the hope. There's a stat article from May 3rd that I'd encourage people to read about how it's becoming more like the flu. It's changing just a little bit, not like it used to.
So, I mean, I have a personal question to ask you, doctor. So when I fly on a plane or I check in at a hotel or I ride the bus or a subway, I wear my mask, but it's about half and half. Should I wear my mask? And I mean, how worried should we be? Because you said live with it, then I should just take my mask off and kind of, what's a reasonable amount to protect ourselves with?
I will tell you at some point, we do have to live with it. It's just never going to go away. And the people who have the strongest immunity, and I'm just doing biology, are vaccinated but also have had an infection. It's called hybrid immunity. We're seeing cases rise in places that were most locked down in this country, like here in the Bay Area. And not in places that had more of that mix of hybrid immunity. So I think it's inevitable that everyone's going to see COVID. I think it's okay to see COVID if you're vaccinated. I think it's going to deepen your immunity, and you can't avoid it forever. But if you want to try to avoid it forever, wear that mask.
Okay, well, hang on. What you just said is something new that I don't hear a lot of experts saying. If you are infected and you get the virus, you are saying that some of these individuals actually have stronger immunity to protect themselves from, say, the next or another variant. Is that what you're saying?
Yes, in fact, study after study has shown this. So I'm not actually saying anything new. You just have to get the right immunologist on here. But study after study has shown this. I will give you 2 examples. I wrote a piece for Clinical Infectious Disease on March 2nd that you can read about hybrid immunity. The New England Journal had a paper last week about hybrid immunity. What happens if you're vaccinated and you get the infection is you get immunity across the whole virus. So if another variant comes along, you have more broad immunity across the whole virus. And epidemiologically, we're seeing that people have had either infection and a vaccine, or the vaccine and an infection, hybrid immunity, have more protection than those who've either had the vaccination or been previously infected.
Right. Dr. Monica Gandhi, I mean, we're out of time, and I definitely want to make it a point that your insights here are certainly a breath of fresh air for someone who's followed this pandemic now for well over 2 years. I look forward to having you back soon to discuss this topic.
Thank you.
From the University of California, San Francisco, thank you very much.